Hi, everyone who's an attendee to this panel. Welcome to Emerge into Equity. We are going to wait just a few seconds more to let all of our attendees join, and then we will get the discussion started. So just about a minute till start. Thank you. Hello, everyone. Welcome to Emerge into Equity, Women in the Time of COVID-19. Today's panel is on health, mental health, and the power of place. This series of conversations is hosted by LA City Councilmember David Ryu, alongside the Los Angeles Commission on the Status of Women. Thank you so much for joining us today. We've got a great panel. I'm going to pass it over to Deputy Chief of Staff Adina Bleich to go over the basics of Zoom and how this is going to work, and then we'll get started. Thanks for joining.
Thank you, everyone, for joining this series of panels. You will notice at the bottom of your Zoom, you have two kind of conversation bubbles. That one is the Q&A function. That would be the best way for you to ask questions as you think of them throughout the panel. And then at the end, after Councilmember Ryu has done some moderated questions with each of our esteemed panelists, we will then read your questions aloud. If you want the question directed specifically at one of the speakers, then just let us know that. Otherwise, we will address the question generally to the panel. So I hope that you all will enjoy, and I will give it over to the council member to begin.
Thank you, Adina. Thank you, Mark. And hello, everyone. I am very excited today for this very first webinar. I'm David Ryu. I'm your council member, and I want to thank everyone for participating and joining on this webinar. It will be rebroadcasted for later on for other people to view. And I also want to give a tremendous thank you to the Los Angeles Commission on the Status of Women for co-hosting this event. Because together with this panel of remarkable women leaders, we are hosting a series of conversations about the unique impact of COVID-19 pandemic has on women. And today, in particular, we'll be discussing health, mental health, and the power of place. We know that COVID-19 pandemic has hit women especially hard. In fact, a recent study showed that women make up 77% of workers in jobs that require close contact and cannot be done remotely. I've personally had a lot of strong women in my life, and largely I was raised by my grandmother. So I have seen the power and resilience that women have, but it is often resilience born out of struggle. So I think, raising the awareness about what's happening during this pandemic for women's health, careers, and quality of life is crucial. And it is crucial that we have these kinds of conversations and bring attention to these issues. But this conversation is not about me. We have a fantastic group of panelists here today, and we should have a lively and interesting conversation. So I want to start with Jackie Provost. Jackie, why don't you go ahead and introduce yourself?
Great. Thank you so much, Councilman, for inviting the Saban Community Clinic to join you in this very important panel. My name is Jackie Provost. I'm the COO of Saban Community Clinic. Behind me is a picture of one of our exam rooms from one of our new clinic sites in the Rampart Village on Virgil. So feel free to come by and check out all of our tool designs that we have in exam rooms. But we're really excited to be here, and Saban Community Clinic has been serving the LA County area for more than 50 years. It started as a free clinic, as a lot of our community health centers in LA start as we understand healthcare is a right and not a privilege. And so our goal is to really ensure that we have not only equitable access to care, but high quality care in the services that we provide. We provide services from mental health, obviously primary care medical services, as well as dental and some specialty services as well. Our primary population are those that are the most vulnerable of our communities, and that we look to make sure that we provide, again, equitable access to necessary and important health.
Thank you, Jackie. Next, I want to introduce, we are lucky to have Deputy Chief Tingirides here to introduce herself and talk us about her new role on this newly minted division of community policing. And this is the first step of us transforming the police department. But Deputy Chief, go ahead.
Good morning. Thank you so much for having me. What an outstanding opportunity, especially now during these challenging times for, quite frankly, everyone. My name is Michi Tingirides, and I have been recently promoted to Deputy Chief to oversee a new bureau called the Community Safety Partnership Bureau. I am going on my 26th year in law enforcement, and I have been serving the community, specifically the South Los Angeles community, for the majority of those 26 years. I also grew up in the community of Watts, and so the community is very near and dear to me. The Community Safety Partnership Bureau is really a new way of looking at policing. It's getting officers to work in a community by understanding the culture of that community, identifying the needs of that community, and then working alongside nonprofit organizations, schools, and businesses to address quality of life concerns, the fears, and the socioeconomics of the community. I'm looking forward to the conversation today, and thank you so much for having me.
Forgot to unmute myself. Thank you, Chief. Next, we have the fantastic Margaret Avineri. Margaret, can you introduce yourself? Did I say your last name right? Avineri?
Yes, thank you so much, Councilman Rue. I'm so honored to be part of this panel today. This is such an opportunity for me and for JFSLA. We are the oldest charity in Los Angeles, dating back to 1854. So we have, in many ways, seen it all. And we today are a very, highly comprehensive network of services, support services, mental health services, and direct concrete assistance to people of all backgrounds in greater Los Angeles. We have, like everyone else, we partner with Saban, with all direct service partners in the community to be part of the future and the hope that we all hold for this community to be better integrated, more equitable, and just for all. So thank you for the opportunity today to be part of this conversation.
Thank you, Margaret. You know, JFLA has been a strong partner in everything that we do COVID related. And I also forgot to mention, Saban, your new clinic over there in Rampart Village, that's my neighborhood. That's where I grew up. So, and finally, last but not least, we have the amazing Dr. Michi Fu. Dr. Chu, you want to introduce yourself?
Actually, Dr. Chu is probably Judy Chu. I'm Michi Fu.
Oh, I'm sorry. Sorry about that.
She's one of my role models because she's also an alma mater from my university. So I'm professor of a clinical psychology PhD program at CSPP LA, Alliant International University. I'm also a psychologist at Garfield Health Center, which is a federally qualified lookalike. And I'm also in private practice as well as a member of APA. We had a public education campaign, so we believe in giving psychology away, and I'm the co-chair of California Psychological Association's Public Education Network. My specialties are in cross-cultural mental health, complex trauma, and gender issues. So thank you very much for having us here today.
Thank you, Dr. Fu. As you know, we got a great group of panelists. So let's go right into our questions so we could take as many as possible. And I want to start with Jackie. Jackie, can you talk a bit about the state of women's health as a community-based clinic in the wake of COVID-19 pandemic? And in particular, if you could tell us some of the trends.
Yeah, so, you know, women make up majority of primary care appointments. At Saban, they make up about 55% of all of our services that we provide. When you think about it, in terms of preventative health, we have, you know, additional systems in our body that need some attention, right? So our reproductive health, our OB and gynecological services were something that we paid extreme important attention to early. Once we started getting the guidance from the county in terms of how services are to be provided, especially our essential health services. As an agency overall, we really transitioned to telemedicine. We were able to really capitalize on being able to provide services by telephone or video, and where we were able to maintain almost the exact same service level with telemedicine included, as patients wanted to stay home, thankfully, as well as we wanted to prevent patients coming unnecessarily into the clinic. But that has tremendous impact on women's services, right? So we got early guidance that our pap smears are to be delayed. So our preventative screens for cervical cancer are to be delayed. If we did have an abnormal cervical cancer screening result, depending on that result, we were to delay further follow-up for in-person services for that as well. So being able to communicate that effectively to our patients, to let them know that while we are in a sense delaying care, we're not impeding their health. And we did that by making sure our providers were available by phone, not for even a visit, but for counseling, right? To just walk through what these changes mean, how does this impact your health, and what you can do right now during this pandemic where we do have some limited access. Prenatal is something you can't avoid, right? We wanna make sure that our prenatal patients stay on track. And so what we did was we allowed our prenatal patients to do alternate telemedicine versus in-person. So reducing the need for them to come in, but not removing the need for them to come in for in-service, where we need to do specific measurements of the fetus as it's growing, you know, observe certain vitals of our prenatal patients. But we have a great prenatal nurse, we have a great prenatal team where we were able to, again, essentially maintain the same level of new prenatal patients that are coming into service, as well as maintaining our prenatal patients on track. And I think, again, the key to that was making sure that patients that did show concern, that were unsure, not really understanding how to move forward, that our providers were available to them outside of visits, just to do a check-in, just to review why and what's important. And we did that as well for pediatrics. We want to make sure that our peds stayed on track of their immunizations, especially early on. And we had some difficulties with that. We had a lot of pushback. And so we initiated our providers to get on the phones and explain why, and also what we do as Saban to ensure that they're safe on site. We do, you know, immediately we started COVID screenings external before entering the site. We do regular disinfecting. We had to shift some of our schedules to make sure that after each in-person visit, the room was fully disinfected. And we also provided barriers and physical barriers for our staff on site as well. So our goal was to, if we had to delay, which we did unfortunately have to delay some preventative screenings, we do have a backlog, but we're back up, we're at pre-COVID levels in terms of in-person visits. We are addressing that backlog about 2 to 3 months from March to about May, where we did have to delay some of those preventative screenings for women, but we're back on that. We're calling these women, we're getting them to make sure that they're up to date, as well as addressing any abnormals or anything of concern that we may find in those screenings. So I think it was just a process for us to really inform, educate, set appropriate expectations. I think that was really something that was critical for our patients to understand what to expect now. And we did that either again through providers, we did care message, text messaging, where we could text message our patients, as well as sending, keeping our website updated with any access to care changes that we were having. But in terms of access for women's self-services, we're back to pre-COVID level. And with telemedicine, we're able to integrate and keep consistent access to care for those specifics, women's health services.
Oh, Jackie, so I mean, obviously everyone had a rough start in the beginning of COVID, but you're saying now, even with the spacing or social distancing, you are at same levels, pre-COVID levels?
Yeah, we are. We're really able to utilize, again, that telemedicine. We alternate in-person versus telemedicine for our prenatals. And we just make sure that women are staying on top and are in regular communication with the full care team, whether it's our nursing, our providers, our preventative care coordinators, really trying to make sure that we're, one, address that backlog and get women back in.
Wow, that's great. That's great to hear. You know what? I want to kind of pose the same question to JFS, Jewish Family Services, because I know you do everything. Saban focuses more on the health aspect and the prenatal and all of that, but you guys do everything regardless of background, religion, and ages. So can you kind of talk about what trends that you've been seeing, and if there's any groups of individuals that might be particularly overlooked?
Thank you for that opportunity to share what is such a broad picture. COVID obviously impacted our work tremendously. Initially, our senior centers, of course, had to close. Our food pantries and 15 meal sites that were all in person were directly impacted, and we had to retool how we deliver those services to delivery of food, direct impact to assist people to be fed. To be honest, we all know, much like what was just described, we all know that contact and direct access is essential to well-being, and that research shows that the social impact is really at the basic needs level initially. So it is food, it is access to safe housing, it is that sense of security that allows people to then attend to their health. And so these social determinants are part of the social work model and the social needs of every individual. So older adults in particular were immediately impacted with fear of leaving their homes. We had to retool our system to bring the services to them. But much like what was just described for Saban, we moved quite quickly to telehealth models and telephone reassurance and check-ins, particularly for our home-based and clinic-based services. So our mental health services, which are funded through the Department of Mental Health primarily, went immediately to telehealth. Fortunately, the tools that we wanted to rely on were allowable, and there was some relaxing of those requirements. And so we were able to continue to work, and now, much like Saban, are able to maintain the level of service that we provided before by supplying also our staff with the tools that they need, laptops and telephones and all of the rest of it. I want to just mention also that the workers themselves, the social workers, tend to be overwhelmingly female. And they themselves are also struggling with the same anxiety, level of responsibility for their children and their families, and may in fact be the only person working at this time. So you can well imagine that they themselves need incredible support, mental health and other kinds of supports from the agency in order to maintain themselves and their families and their work. In terms of what you just asked about a special population, there have been a couple populations that emerged that we did not necessarily serve prior. And they are often the women in the 55 to 64-year-old category who used to be employed, who may be newly unemployed, who do not have experience accessing social services in the past, and who are now coming to us in larger numbers. They are either alone or they are caregiving for others and have never really utilized our services in the past, and they are coming to us in increasing numbers. I'll stop here, and hopefully we'll circle back later with some other information.
Thank you. I was going to ask you specifically for women, but you answered that, and I'm going to put a plug in it because actually I want to talk to you about seniors later if we have time.
Yes.
Senior population, but I want to actually ask Dr. Fu now because I know in your comment or your thoughts on, there's so much uncertainty that people are facing during COVID-19. And I want to ask you about the trends that you've seen in the workplace environment, especially the impacts to mental health for essential workers as the workers who are working at Saban and Jewish Family Services, right? And their mental health impacts for especially women. What trends do you see and for that?
Okay, thank you very much for that insightful question. First off, women are being disparately impacted, as you had mentioned with the earlier statistic. One is that sometimes they tend to be employed in sectors that are not considered essential workers. So the unemployment rate has hit women differently than men. Also, the roles that they tend to be in may not be easily transitioned into telecommuting type of positions. So now they're faced to choose between different priorities. So they could have employment, but they may be posing a risk to their family members, or in terms of multiple role management, having to renegotiate domestic issues such as childcare. Most of the folks that I know of, even if both partners are able to work from home, for some reason, not just childcare, but other things like meal prep tend to fall on the women. And then in general, in terms of how COVID has been impacting women's mental health in particular, in addition to just the increase in anxiety and depression for the general population, we're seeing a lot of deaths of despair. So those include deaths by suicide, as well as fatalities resulting in accidental overdose or substance use kind of stuff. And other layers that are there, not necessarily gender specific, because we know that men are also victims, but intimate partner violence has gone up. We saw that in the spring, like France and Spain started seeing triple the numbers within a few weeks of going into lockdown. And then as a final the nail in the coffin, I guess, is lack of access to right of bodily self-determination. So especially in certain states where we're not able to make decisions for ourselves. Those have been especially problematic for women.
Wow, thank you for that, Dr. Fu. And actually, I've been supporting Planned Parenthood because they have been getting an influx of cases and appointments from out of state. And obviously, with the whole coronavirus pandemic, it's been exacerbated. So yeah, wow, thank you for that. And I want to pose a question to actually Chief Tingirides now, because you're actually on the ground, you're actually working, and obviously our society lacks equity in so many ways, and we're starting to fix this. And you literally, your bureau, I can't say that word, bureau, exercise division. Yeah, your newly minted division, you know, is what reimagining policing is about, and reimagining public safety that begins with community input. So can you talk about the community safety partnership model, but actually talk about the role of women in that, as we transform the police department? I know we did a much better job. We still have to do a better job of recruiting women, but women can serve in so many different ways, especially now. So if you could kind of comment on the community safety partnership and the role of women.
Absolutely. I first want to start off just sitting here listening to Dr. Margaret and Jackie and Dr. Fu. Thank you so much for allowing this space, council member. It's so important. We get so busy in this pandemic and don't take the time to really sit and think about the impact it has on our communities emotionally, mentally, and physically. So this conversation is so important. And it's crucial as it relates to women, as we know, who end up being the primary caretakers in a lot of the households. So thank you so much for allowing this space. And Dr. Fu, you talked about the anxiety and what people are feeling. And one of the things our officers are seeing on the ground that are assigned to the Community Safety Partnership Program, that are walking footbeats in our public housing developments and working in areas where there has been an increase in violence and a lack of no trust between law enforcement and police. And there is this anxiety. There's Los Angeles Fire Department's doing free COVID testing at some of these locations. And our officers are going out trying to get people to take advantage of that free COVID testing. And there is a true fear. People not understanding the process, people not believing that they will get the results from the test, and then officers trying their best to pass out the flyers and explain to the community that it's really a simple process and you can get your test results back quickly so that you can better care for yourself and your family. So education and communication is so important. Jackie, my mother's a nurse practitioner in OBGYN, and she talked about those same things, about the anxiety of women coming in and they're pregnant, and are they still going to get their health care, and can they still make their doctor's appointments? And the fear that people have in some of our underserved communities is real and raw. So blessed to have Dr. Margaret, your federation, and what you guys do so that the community understands they do have a place to go to address their mental and physical well-being. Part of the Community Safety Partnership Program is understanding these existing resources that are in the communities so that the officers are armed with this information, and when they come across these families, they know where to tell them they can get this help, where they can get answers to the questions that they have in the community. I myself, as a mother and a first responder, I have 6 children, and I know there's anxieties as it relates to what's going on across the country with law enforcement right now, and then working during this COVID time and putting myself out there to ensure that I'm there for other people. So part of what our program does, and the reason why the chief found it to be important to create a bureau centered around community policing, was just that, a bureau where officers can get out into the community, understand the needs of the community, address some of the concerns of the community, and then work alongside our schools, our nonprofits, our for-profits to really address the underserved, lower socioeconomic communities throughout the city.
Thank you for that, Chief. And when you have your new bureau as you're working, I actually want to ask how important or what is the role of women, especially for something like, because we're trying to take calls off of the police, armed police officer, and we want social workers, mental health workers to respond to a lot of these calls where they're more effective on. And when it comes to issues of domestic violence, you would normally think you want a clinician or someone, dispute resolution mediator or someone like that to go. But as we've seen, domestic violence calls could be one of the most dangerous calls. So actually It's been recommended by both the practitioners and law enforcement that they respond. So when it comes to DV calls, what is the role of, does it make a difference that a woman officer is there?
I will say, I'm not being partial, but you know, the LAPD now is 18% female, and we're still looking to raise that number. And women have the ability to show empathy and compassion and understanding and patience. And I can recall working with multiple men throughout my career where I would respond to a domestic violence call and oftentimes find myself taking the lead just because of my ability to understand and empathize with that victim. And most times the victim is a woman. And so I think that female police officers bring this a special nature to policing. You know, right now we have this emphasis on de-escalation and, you know, reverence for human life. And part of that is just slowing down and taking the time to talk to someone. We have domestic assault response teams where a police officer rides in the car with the clinician and they respond to these domestic violence radio calls. Oftentimes that response is after the initial patrol car has gone, the individuals have been separated and there's an understanding of what occurred. And that clinician responds with the police officer to assess what the needs are in the family. Are there mental health concerns? Is there a restraining order on file? What is the root cause of this violence? Is it because there is a lack of food in the house, or someone within the family lost their job? And is the root cause of this violence really due to the stresses that life brings? And then what resources can we bring to help address it so that that type of violence doesn't happen anymore? I fully support the narrative of bringing in other entities and agencies that are better trained and more equipped to respond to our mental health radio calls and concerns, to respond to the domestic violence issues that occur. Right now, law enforcement is the only 24-hour, 7-day-a-week entity that gets that radio call at 2, 3, 4 in the morning when someone has to respond to a neighbor dispute or a conflict or in a tree or domestic violence or someone having a mental crisis. If we can get other entities to help work alongside of us to respond to those type of incidents, I think we'll have better outcomes.
Thank you for that. Yeah, no, I think you're on the right track, and we are all on the right track on this. You know, and you know, I'm gonna get back to that, but you know what? Let me, for the sake of time, let me go back, and I want to address two particular populations: seniors and young women and girls. So why don't I start with Jackie? You know, for these specific populations, what are the 3 basic growing health impacts for women and girls that you're seeing in the clinic since the pandemic began? And is there, and if there is an impact, how can we mitigate it?
Oh, that's a good question. I would say for women and girls, the greatest impact because of COVID, again, is just ensuring that they know that services are still available, any level of service, especially for our young girls, and knowing, you know, staying on top of whether that's their immunizations or their reproductive health needs and sexual health needs, most importantly as well. So, you know, it's about communicating, effective communication, targeting to those populations where they would be able to get the information. So we really picked up our social media messaging that we have, making sure that all of our patients and communities know that we are open, that we are a safe space, that we have taken the precautions to ensure that you can still access the care that you need when you need it. I think for our seniors, the hardest part has been that transition to telemedicine, especially for services where they feel they need to see the provider. And so, you know, early on, you know, we started with every initial appointment, we wanted to make sure it was a telemedicine appointment for the provider to assess the need for the patient to come in and making sure that they could come in a safe manner. And we got a lot of pushback for that. No, I just want to see my doc. I don't understand why I can't see my doc. And so again, that what we really wanted to work on here at Saban is ensuring that our communication was effective, and setting, again, appropriate expectations, making sure that they understood the full process of what it means to access your care. We also started delivery services for our medications, free delivery for our patients to make sure that, especially for our seniors who really just need a medication refill, that they were able to still get those medications in a timely manner without putting themselves at risk. So I think for our seniors is the transition and the use of technology. So there's still a lot of work for us to do. We're working right now on updating our website with instructional videos, how to access the video visit, where to do your video visit. We found a lot of patients, especially on the phones, would be in the grocery store, would be at the park watching their kids and still having their visits. So making sure that our patients were in a safe, confidential space, not driving, and where they could do their telemedicine appointments. And then lastly, we also implemented some at-home monitoring devices. So where our seniors or those with chronic conditions could take their blood pressure at home, how to do that. So our providers would have a visit just to instruct them on how to use those at-home monitoring devices. So whatever we could do to, ensure that if they were coming on site in person, that it was necessary, that they felt that it was safe, and we had the safe precautions available. But it's about communication, because available services are there. It's about ensuring that patients are understanding and their anxieties are addressed, and that they know how and what we've done here on site to make sure that their in-person visit is safe and appropriate.
Thank you for that, Jackie. Mm-hmm. Yeah, no, thank you for that. And I also want to put in a plug where anyone hearing, if you have anybody who is home-ridden or who is a senior, we actually have a Mon Ami service on my website where we link individuals who want to help their neighbors go pick up medication, go pick up groceries, and all of that. So, you could connect people to my website, people who want to volunteer, and also people who need pickup, like if they need to pick up medication at Saban, right? We have that resource. And I want to pose this question to Margaret as well. Great. But I do want to remind people, I have a whole bunch of questions, but you guys could ask questions too. There's the Q&A function, so put your questions in and we'll get them in. We're doing great on time, and there's also the chat box. But Margaret, there's so much discussion about seniors, and we know seniors are one of the highest affected groups when it comes to COVID-19. So I wanted to get your thoughts. You could also comment on young women and girls too as well, but in particular seniors, their effect of mental health, on their isolation, because we're telling seniors, stay home, stay home, stay home. So what is that impacting them? And also, is there a different type of impact between men and women? Oh, you're on mute. Oh, there you go.
Yeah, you are doing the unmuting. Thank you. There's so much to say. I do want to just mention to connect with the question of also younger women. Younger women are also reaching out in larger and higher numbers. And we have found that telehealth has actually opened up avenues for many of them to access services when they did not previously. Both domestic violence calls to our hotline have gone way up. Participation in our groups for domestic violence, and we have a postpartum group for women that has grown exponentially as a result of telehealth, because many of those young women could not make it to a group in person, and now are taking advantage of this opportunity. So there are myriad opportunities here also that have opened up as a result of this very, very difficult time. In terms of seniors, I had talked earlier about an unusual group that does not have access yet to Medicare, who may not have paid in such a way or prepared for this period in their lives. In their late 50s, early 60s, they do not yet qualify for Medicare and other kinds of supports, and are now finding themselves with housing instability, food insecurity, many things that they never thought they would face, and who are experiencing, as Dr. Fu said, extreme activation of previous trauma, of concerns that they really have never addressed in the past in many cases, and who are now reaching out, starting with their basic needs. And then, of course, their mental health needs are quite overwhelming. I did want to mention that our mental health services that are primarily adults and older adults have, in the first half year of 2020, have reached almost the same number served as all of 2019. In addition, the ratio of women to men is now 3-to-1, where last year it was 2-to-1. So I actually pulled those numbers purposely to see if there was something that we had not yet fully observed. And then in terms of older, more frail adults in their 80s and 90s, some of them were still quite active in our senior centers, which are now closed, were part of activities and all kinds of stimulation that is not available currently due to COVID. And for them, the contact that we make through telehealth is key to maintaining connection. We're fortunate to have a partnership with an entity that has that is able to do telehealth through the television, through a special box. And we have been able to maintain activities and clubs and interactive opportunities through that platform. Those kinds of innovative things are what are keeping many of those seniors connected. Because as we know, overwhelmingly, women seek connection. That is how we survive. And this time, the isolation, the difficulty with the basic needs of life, such as food and feeling secure in your home, those are all activated now in ways that we never dreamt of. And so we are increasing our contact as best we can. Right now, we cannot go into their homes in the way that we used to, nor can they come to our facilities in the same way. But those times will come. Partnerships, as was mentioned earlier, partnerships are going to be key for us as a community to reinstate a sense of place and of belonging that we are all trying as hard as we can to maintain. But clearly, the challenges are enormous.
Thank you for that. And talking about special populations, I want to ask Dr. Fu, as a practicing psychologist, what are some of the biggest stressors out there for women in particular? And also, can you comment on specific mental health needs for women in different ethnic groups, if there is a difference?
Okay, so earlier I had just mentioned just some general mental health considerations related to COVID and gender, but I also failed to address your other part of the question about essential workers. So in addition to all of those stressors, those that are in frontline positions are accustomed to being in the role of a helper, where we're oftentimes extending ourselves to the community. It's really difficult then for, say, our local firefighters to see themselves in a position of asking for help, which they deserve. In addition to that, there's something called caregiver burnout that we may suffer from, and as well as compassion fatigue. There's a lot of literature about it, so hopefully you work for an agency that really cares for your own self-care. And just as a reminder, there was a physician who died very early on by suicide during the pandemic. So those are just some snapshots of essential workers, kind of coupled with the gender. There are some trends we're seeing across ethnic communities. So let's just, look at African American communities are also dealing with Black Lives Movement and just existential angst related to their physical safety. And then the mortality rates just for COVID alone are desperately impacting African Americans. But Latinx communities also have a lot of frontline employment where it may not necessarily warrant a PPE from their employer, but it is absolutely essential. So as an example, I belong to Anti-Sewing Squad, where we are making masks to deliver to migrant farm workers, for example. Asian Americans also require an extra level of vigilance, for example, to mask or not mask. Are you going to be seen as someone who is bringing the Chinese virus, even if you're not Chinese, or being associated with Kung Flu because of whatever is happening from top down? And then Native Americans, we know that they had a lot of red tape trying to access some of the federal funding that they were allocated. So all these different groups have their own challenges, and never mind, it tends to impact ethnic communities, but the undocumented parts of our community as well. They have their own special challenges.
Thank you for that, Dr. Fu. And, based on that question, and this is the title of our webinar as well, Power of Place. So I want to actually have the chief answer this one, but I want to open it up to anybody else who wants to answer it. So I want to talk about power of place in two aspects. Power of place of the workplace, right? Maybe what the police department is doing to foster an environment for women to succeed, and also how environment and society impacts women in general, and especially during this time of COVID and the mental health impacts, right? So, and because Dr. Fu talked about the various burnout, especially for essential workers and front end workers. So can you, Chief, can you lead it off?
Absolutely. I think what's really key is I'm looking at a success story of a female promoting throughout a predominantly male workforce. And I think that the LAPD has come a long way as it relates to the officers mirroring the community that they serve. We are currently doing a lot of recruitment and targeting young women, but not just targeting any young women, but women that come from the community, that can relate to the community, that want to come back and serve and help within their community. We have a lot of youth programs, our cadet program, we have volunteer programs where we're constantly encouraging individuals to come in and learn about law enforcement, learn about what it takes to become a police officer. And the important piece of that is building that leadership for individuals to have the confidence that they too can come back and serve their community. I remember once I was at a double homicide, and there was an African-American gentleman that came up to me and he expressed his concern of not seeing very many females on the police force, but also not seeing police officers that look like him and look like me. And I remember in that discussion telling him a part of the concern is so many people spend time telling people within the community not to like them, to stay away from the police. And like this panel today, we have to have acknowledgement of our history and our past to understand those fears, but then become leaders to be able to encourage other individuals to see the change and be the change that they want to see. And so I think that in my 26 years on the LAPD, I have seen our organization change. I have seen a lot of women that look like me who promote throughout the ranks. But I think what's most important is having the heart and the empathy to want to do this job and give back and work in the community. And that's really what our police officers are about. I think the Community Safety Partnership Bureau, a lot of what I'm seeing when people interview to work this program, we do have a lot of female candidates who want to promote within our organization, and they want to do it through policing and relationship-based policing and building cultural awareness in the community. So it's a huge opportunity to have a program like this where part of the requirement is to have that empathy and understanding and want to remain in a community for 5 to 6 years to really get to know that community and make change in the community.
Thank you. Thank you for that, Chief. You know, I'm gonna, before I pose the question of the meaning and the importance of power of place and how environment and society directly impacts us, and especially women, to Dr. Fu, I wanna give an opportunity for either Margaret or Jackie, if you wanted to add to that, especially in your workplace environment.
I mean, I think we have to, as you know, as administrators of a community health center, essential health workers, you know, majority of our front line are women, women with children, women with that are caretakers of parents, and you know, we were able to have the First Responders Act be able to provide extended leave opportunities and allow our staff to be able to put their families as a priority during this really stressful time. Our goal is to be as flexible as possible and also to be very, try to be as proactive as possible, but also very, very responsive, right, to any concerns of staff on site. Because those are services that, you know, your registration, your medical assistance and nursing, your call center, these are all services that we can't have as remote. And so being able to make sure that that they understand that their safety is being regarded and addressed as appropriately and timely as we can, as well as being as flexible as we can to ensure that they can meet their families' needs during this time, because everyone's going through some extraneous situations. When school came back in the fall, we had to figure out how to manage schedules so that, you know, families can, you know, have to take care of their kids if they need to while they're not in school. So most important, the biggest lesson we learned is flexibility and an accommodation, and ensuring that they had access to our own services, right? So our employee assistance program, ensuring that they had access to get the care that they need, you know, ensure that everyone is fully covered on our health insurance as well. So that was our main goal, is just to make sure that they had access to care. We were flexible and as accommodating as we can be to their own personal schedules and needs.
Great. Now the questions are coming in and we only have 5 minutes. So I'm going to turn it over to Dr. Fu, if you could tell us more in a global setting of the power of place, the importance of power of place.
A lot of folks focus on the things that they don't have control over during times like this, and that's the part that's going to make people nervous or feel hopeless and therefore sometimes depressed. If you focus on the things that you have control over, like Stephen Covey talks about this in the 7 Habits kind of stuff, but in psychology, the locus of control, if you focus on your internal locus of control, then that's what's going to make you feel a little bit more grounded. In order to do that, there's obviously having an understanding of how resources are allocated and being familiar with not just governmental guidelines that serve more as a baseline to establish safety guidelines, but even having a personal idea of what your own comfort level and tolerance is for safety practices and things like that, and then being able to communicate that properly to others helps us to have some groundedness. Finally, being able to be counted either through the census or registering to vote, feeling like you have some agency in helping to set some of those baseline guidelines sometimes helps people to feel like they're more connected to their communities.
Great, thank you for that. And you know, I think we can go over actually, and if people have to jump off, they could jump off. So we'll just go a little bit longer. So Margaret, sorry, did you want to add? I mean, I have a whole bunch of other questions, but if you wanted to add, you can.
For one, I wanted to, for one, I wanted to echo much of what Jackie said. Fortunately, JFS as well, family is in our name, and there's a reason, because we see ourselves as a family, and those who work with us and for us, hopefully we accommodate them at all of the levels that Jackie described. During COVID, we have accommodated families in every possible way that we could, extended leave, additional, for those who have to be on site, we have given them additional pay as compensation for that. We've extended ourselves in untoward ways, and hopefully we have provided opportunities for our staff to meet more frequently with us. It's interesting that telehealth does allow for that. It helps us to stay connected in new ways and more frequent ways with our own staff, and to be supportive of them in every possible way. We've gotten to know their children, their animals, you get to see people in their element. So I want to say that that really does play a key role in supporting our clients, because if our staff are feeling strong and empowered and supported, hopefully that translates to the work that we do. In terms of what we're seeing in our mental health work, Dr. Fu said it well. We endeavor not only to provide support, but to provide the framework where people can explore where they can feel effective, how their voices can be heard, how they can still feel that they have efficacy in their own lives and can affect change or maintain themselves independently and with dignity. And that is really, hopefully, the antidote in some ways to this very, very difficult time.
Thank you for that. And you know what? Jackie Fila, our president of the Commission on the Status of Women, asked a very great question. And this is an opportunity for you to tell me what you guys need. But and anyone could answer this, what are the largest gaps in service provisions you are seeing? And in your view, how can the city help address them? So it's open-ended for any one of you. Opportunity for you to ask. Jackie, Dr. Fu?
Sure. I think this may be too big of an ask, I don't know. But because we have seen such success with telemedicine, because we have a lot of kids in school, kids at home doing remote learning, I think access to Wi-Fi, internet services is critical. And I think that this is a great opportunity for us to look at the city of LA to see, are we at a space where we can have citywide access to internet services for our residents?
That's such a good point, Jackie. So upon reflecting upon what about those who don't have insurance to cover their health needs, I came up with like internal resources that people might want to first try and access, and then external resources to answer your question. So the internal include things like have some self-compassion and understand that there's something called decision fatigue. So if you're trying to decide what to eat for dinner and you suddenly find yourself crying, it's probably because you have bigger fish to fry. Like, if we get evacuated from the local fires, where's our rendezvous point? So sometimes small decisions that overwhelm us need a little bit of compassion from ourselves. Also, someone had mentioned it earlier, the ability to exercise flexibility has been one of the key indicators of how resilient someone can be, and that's a huge resource during a time like this. I've been encouraging my own patients to practice mindfulness and acceptance. So I know someone who said, I will never complain about the weather because it is what it is. Complaining about it will not change. In some respect, being able to voice our concerns about COVID, fires, etc., is helpful, but at some point, learning to accept the things that we cannot change, kind of like the serenity prayer, can be kind of anchoring. Also knowing when it's appropriate to ask for help, because sometimes we're so accustomed to try and not bother others. And at the same token, it seems rather paradoxical, but being able to help others in times of emergencies sometimes gives us a feeling of agency. So whether it's offering an elderly neighbor to pick up groceries for them or to foster an animal kind of a thing. Okay, so those are the internal resources, things that we have some control over. To answer your question though, the external resources. So I would first say know who your pods are in terms of family, friends, and neighbors that you can rely on, whether it be fire evacuation or babysitting and things like that. Understand your local resources, both in terms of like Department of Mental Health. There are some opportunities for indigent cases. State and federal also have some resources as well, although we know that with Medicare, there's always threats to eliminating or changing the benefits. But I used to work for over a decade at Pacific Clinics, and I'm currently at Garfield Health Center, where we do have some wiggle room in nonprofits, especially when they have some programs dedicated to indigent clients. Also, don't overlook private resources such as pro bono private practitioners. I have a few on my caseload, or faith-based opportunities to go for counseling and things like that. When all else fails, I always direct people to 211 because they're multilingual, or even using your phone for certain apps. In terms of what can the city do, I think being able to look at Maslow's hierarchy of needs, the bottom part where we're looking at housing insecurity and things like that, being able to look at rent control or rent subsidies will go a very long way to helping to ground people in their mental health. Thank you.
I would echo in terms of our unhoused population. We have a street team that goes out to local shelters on the street and to some housing programs. And just recently we had a threat of the Pan Pacific shelter being closed way too early. And so I think if anything, we could just make sure, if not closing, expanding our ways that we can support our unhoused is really important. And working with partners like Saban, other community clinics, other service providers that can do more street outreach and connecting to patients where they are, where they need to be serviced, I think is critical. So whether that's funding, whether that's direct service provision, facilities, really looking at how we're coordinating that care is critical. So we're a partner in that, and we'll love to continue to partner and expand and grow for our unhoused.
Thank you. Well, Pan Pacific is actually still open. I made sure it didn't close. So
no, it's open. We were able to save it, and yes, but yeah. Mm-hmm.
So and when it closes, we're going to make sure we convert it to some other, whether it's a cooling center, and even in winter's right around the corner too.
Yes.
Whether it's any kind of shelter of any kind. But I want to echo what Dr. Fu said. If part of your mental well-being is if you want to help others, mon ami, very simple, right? Like I said, we connect you with somebody in your neighborhood, and you could do it as much or as little as you want. In fostering animals, we're fostering 2 baby kittens too. Oh my goodness, when pets, animals, so relaxing. But well, they're quite a workload too. But it's a happy workload. And on that note, there's 2 questions. Well, let me ask the second one later. But I do want to ask. Dr. Fu already kicked it off. But for people on this call who might need resources or want to get involved to help your particular agency or any other way, like I said, mon ami, what is the best way for people to do so? So Margaret, can you talk about resources, how to get resources, and how people could get involved? Oh, wait, let's unmute. There you go. Margaret, go ahead.
That I was going to say earlier that one of the ways that the city can help us is to help with communication and communicating these resources to the greater population. There is capacity out there in this vast network of social services and health services, and we want everyone to know that we're here and that we are available and accessible to them. So that would be one thing on our wish list. As far as JFSLA, it is very straightforward. We actually have a new website we just launched that it has better information and clearer information for you. So jfsla.org, click on volunteer, click on any area that is of interest to you, and there will be a main phone number that you can call, and you can start there. We welcome everyone who wishes to contribute, support in any possible way, as we do with others.
Jackie, you want to comment?
Sure. I guess to get involved with the Saban Community Clinic, you can visit our website as well, sabancommunityclinic.org. And you can drop us a note or give us a call there. We actually are partnering with some local student volunteers who are collecting devices for our senior population, so tablets and cell phones and things that are internet capable. So we will love to continue those types of gifts, things that really benefit our patients, we welcome. Early in this pandemic, we got some great donors that helped our staff. We had lunches provided, we had snacks provided. So, you know, we welcome it because the frontline team are really, really resilient, and they've been through a lot. And so any way that you can partner with us, we welcome it at all times. But also we, you know, Dr. Fu, you did mention in terms of lack of insurance, we do provide insurance enrollment services for My Health LA, which is our low-income health program through the county, as well as for Medi-Cal and Cover California. And we connect you to Medicare advisors as well. So there shouldn't be a lack of coverage at this time. We expect to see an increase in enrollment on public insurance programs.
And I believe both Saban and JFSLA, irrespective of ability to pay, I mean, for Saban, it's in your name, free clinic, right? And
no, it's not.
Yeah.
It's affordable. It's low cost to affordable.
Yeah. So that should not be a problem. And I know JFSLA also, irrespective of your background and income level, they make sure you get services. Chief, do you want to add a talk about how people could get resources, where they could find resource page for what you're doing?
Absolutely. And what we have found really in a lot of our CSP sites is resources coming forward already. Every Wednesday in Imperial Courts Public Housing Development, there's a grab and go and a food giveaway. Monday through Friday, there's something going on within our community safety partnership sites, whether it be the free COVID testing, whether it be the grab and goes, whether it be clothing. However, we are right now encouraging individuals who want to get involved to become a volunteer with the Los Angeles Police Department. You could go on to our lapd.online website to obtain information on how to become a volunteer. And what we're finding is our volunteer applications have increased, and it's individuals within the community that want to spend their time helping out, but not really quite sure how to or what to do. So because of COVID, we haven't been able to have volunteers in the police station answering the phones and being hands-on. But what we have found is they're coming out to the communities and helping with the food giveaways, packaging food, helping signing people up for the COVID testing.
Thank you. Dr. Fu, did you want to add anything more?
Yes, I think the most important entity to help during a time like this is oneself. So really exercising the importance of self-care will go a very long way to reducing the challenges that entities are facing in terms of resources. I'm not kidding, but I intentionally teach a Psych 101 course to over 115 students, and I tell the undecided majors, please enter the behavioral health force because there's a workforce shortage, especially among ethnic populations as well as other vulnerable populations. You will always have a job. You will always have a wait list in the foreseeable future, unfortunately. And I inadvertently picked a profession that was able to transition during times of COVID, and I need more colleagues. So please consider that as a longer term goal, because sometimes gifting our resources to others can multiply the returns. Thank you.
That's so right, Dr. Fu, especially everyone in the service industry. You know, there's that whole Messiah. I remember I read the book Messiah Complex, right? You can't help others if you're not well yourself, and you don't want to have that burnout and fatigue, because yes, this is such a high time for so much need. And when we give so much of ourselves, then, you know, when you come home and just collapse, right? It's just, and especially Zoom meetings, you think it's easier, but it's, the blue light apparently strains your eyes, and it's even more difficult. So we have to take that time for ourselves. That's so important. And, you know, on that note, on that ethnic component of it, I want to have Deputy Chief Tingirides and maybe someone else answer this about, you know, 1 o'clock is a hard cutoff. That's 30 minutes over. So I want to get these questions in about domestic violence and mental health. It's from Cindy. It's not talked about, especially in certain ethnic communities, due to cultural perceptions and cultural differences. And many will not admit that they need help, and therefore do not seek help. And sometimes they think it's weak or it's someone with problems, or it's embarrassing. It's a shameful for their families, and so they keep it even more hidden, and add a language barrier on top of that, even more difficult. So I want to know what kind of outreach is being done for ethnic communities to encourage people to seek help and be vigilant of their surroundings when it comes to domestic violence. So I'll have the chief answer it, and someone else could jump in as well.
That's a great question. I will say our biggest resource our victims assistant advocates that are assigned to our police stations. Officers will respond to domestic violence, radio calls or incidents. Oftentimes there is a language barrier, or oftentimes people are just afraid to really talk about what happened. And it's easier to have our victims assistants make contact with those individuals. They feel more comfortable talking to those individuals, so we can ascertain what the needs are and concerns are within that family. So utilizing our other city partners and entities to help break that barrier is really important. Also, one of the things that we've done as law enforcement is having officers spending time getting to know the families, getting to know the needs of the families, and understanding what's going on in the homes has allowed them to partner with other existing resources to address those needs. Right now in Watts, Children's Institute, who does social outreach, they help with counseling, they address post-traumatic stress within families, and they serve the whole family, is a resource that our officers reach out to on a regular basis to help provide at least a platform for the families to understand what resource that they can go to. I think it's very difficult to be in uniform and for families to accept us as seeing someone they can come to ask for this type of help. And that goes back to the purpose of this new bureau, the Community Safety Partnership. It's partnering with the other existing resources in the community to address the needs of the community.
Great. JF, yeah, Margaret, go ahead. Can we unmute her?
Yes, hi again. With regard to domestic violence, clearly once it reaches the level that law enforcement is involved, that is at a very high level of the issue. But more often what we're finding, we have a domestic violence hotline, we have shelters, both emergency and transitional long-term. And we find that often what is helpful is at a much earlier point, people reach out simply to speak with someone. We have volunteers who man those lines, and we have professionals that provide ongoing counseling as well as groups. And as I mentioned, during COVID, these numbers have been astronomical. So it connects people also to the ultimate resources if they need them, but it also helps, in many cases, women who cannot leave, who will not leave, but who have to somehow survive within that family constellation with children. And the services are invaluable. We do it in our case, 2 languages, Spanish and English, and connect people to additional resources if at all possible. At least the lifeline is there, and those resources are not just with JFSLA, it is a vast network of resources for people who find themselves in high conflict relationships. So it's important for people to know about those resources so that they will at least reach out.
Great. And Margaret, there was a question that came in earlier. What languages do you provide services in?
Currently, we primarily serve Spanish-speaking, Farsi-speaking, Russian-speaking, and in some of our programs, we have some other languages. We also do use interpretation services, which I think in LA is honestly an essential service that is incredibly helpful. But we have staff that represent at least those 3 languages.
Yeah. And I also want to mention the county's 211 line, which is staffed in all languages for any kind of domestic violence, mental health, any services, because, you know, the county is responsible for all the social services, and they have a multi-language prompt. So when you call 211, I think they come up with the 8 threshold languages that you could pick from. So that is also a place that you could call. I don't know if anyone else has a different resources for language. Chief, do you want to say something?
We utilize the language bank as well. So no matter who we come across, if there is a barrier, we do utilize the language bank and connect that service with the individual.
Okay, Chief, I want to ask you one more question. It's a multi-question, but then I'm going to try to narrow it down about, are you pushing to get the domestic and sexual predators out of the police force? I don't know if that's above your pay grade to answer that one, but and also can you comment on removing domestic and sexual predators out of the police force, rape kits, backlog of rape kits, and I know that's also a state issue as well. And the third one is guns. So when you're trying to build safe trust within the community, you know, the effect of an armed officer with a gun. So your comment on reducing the use of guns, I guess. Yes.
That's a loaded question.
Yeah.
I will tell you, the CSP program has been in existence for almost a decade. Just recently, the UCLA conducted a study on the program, and they went back out to the community to ask them their perspective on the program. What's really unique about the program is prior to the officers working in these communities, there's an assessment done by a nonprofit organization. Connie Rice, who's a civil rights attorney who actually helped co-create this program, decided that there needed to be a better footprint and a better relationship with law enforcement in the community. So this nonprofit organization went out to the community and asked them, if you had officers, what would you like to see them do within the community? What resources are existing in the community? So the officers were given this blueprint prior to being deployed out into the community, so they'd have an understanding of where they're working in the community. So this program has been in existence for 10 years, and we have been able to see a huge increase in trust building within the community and a huge decrease in violent crime. One of our most recent CSP sites was in Harvard Park area, where we had 5 murders in the park. Since the CSP program started, we have not had a homicide in the park. So the purpose of the program was to select these communities that were experiencing a high volume of crime, homicides, rapes, and robberies, and place police officers in those areas to get to know the community, to build the trust, and in turn reduce the violence and increase the relationship with law enforcement. Violence is still occurring within our city, and police have to respond to that. I think what's most important is also understanding the other resources within the community to help address that violence. And if that's looking at the mental health, addressing the post-traumatic stress, education, ensuring there's safe routes to school for our children to travel back and forth to school. It's a holistic and public health approach to addressing the concerns in the community. As it relates to our sexual assaults, we have made huge inroads on addressing the sexual assaults and addressing our backlog. We partner with Santa Monica Rape Treatment Center. Our officers are trained in the response to sexual assaults. We partner with existing hospitals that do the rape treatment kits, and it gets processed through those hospitals. So as we work towards the funding and addressing that backlog, LAPD has definitely set systems in place when we respond to our sexual assault incidents.
Thank you, Chief. And this is the final question, because we got to really close now. And, you know, I want to ask you, you're personally, how are you all keeping your heads up and staying focused in this unprecedented time? So tell us some of your strategies. Why don't I start with Jackie?
I guess I'll start by being so thankful for my dog. I'm single. And so just, being home alone, having my little Coco with me, has been tremendous. I joined Saban officially, as the COO this past July. I was there for a year as a consultant. And that has been just a tremendous positive impact. It's just a new focus, a new energy. And working with, again, an incredible team here at Saban has been very positive and very positive impact. So it's been difficult. My mom's up north, and so being able to stay in contact, it's just looking at the positive. I just always try to find the silver linings, and that's what I find has been the biggest aspect. But I'm doing okay. I'm all right. Thank you.
Oh, Margaret, go ahead.
I have to laugh. We all, we're all human beings, and we all have the same needs. And I think that this period has been an equalizer in so many ways for us all. We realize we're all part of the same human race that is facing the same challenges, and perhaps that's been helpful. I know for me, obviously, family is key. I have children and grandchildren. We stay in touch. I don't see them in person with the exception of the ones who are very, very close by. Work, I'm so grateful for my work. It gives me purpose. It gives me focus. And I do want to say one other thing about women and resilience. Challenges come and challenges go. And we hopefully bring what we have learned in our own lives and in the lives of the ones we love. We bring this to every challenge. I find that with our clients, with those we serve, I see as resilient the fact that women in particular reach out for help. There is no shame in it. And the fact that we are usually representing those around us and among us, we tend to ask for help. And I see that as a sign of resilience, and it certainly goes for me as well.
Thank you for that, Margaret, for sharing that. Actually, I'm really thankful to my wife too, because, as a council member, I'm never home, and she used to complain, but now I'm home all the time. But then she made me realize being home is not really being together. And we're also doing counseling as well, because it's actually even more stressful, because when I'm stressed out, it affects the family. It affects her. And she's the one that made sure that we went and got, counseling, and there's no shame in that. I've worked in the mental health arena for such a long time, and, and it's okay. And we all need help. So, and if it wasn't for my wife, I would have not thought about that, right? Because I'm just doing what I need to do. So I really appreciate that. But yeah, and I do have 2 cats too, just like you, Jackie. It's like they're a blessing. Chief, you want to tell us what you do?
I have 6 children, so I keep myself very busy. Our youngest just went off to a university. So I think what keeps me grounded and humbled during this difficult time is the community. The outpouring of love and understanding and the gratitude that they have is what keeps me going. I also think that the hearts of the police officers who wake up every day to go out and serve the community with compassion and empathy is what motivates me. And I think the heart of this city and the resiliency that this city has is what wakes me up every day. And then what's most important is this panel and the resources that exist. We've spent an hour talking about what resources are here for the community and how we're working through this difficult time to ensure we address the needs of everyone. And that's enough motivation for me. So I stay humbled and grounded, and I know that things will get better, and that's what gets me through.
Thank you, Chief. And to close it out, Dr. Fu?
Okay, I'm always encouraging my patients to do as I say, not as I do, but I do try and practice very hard some COVID tips that I encourage my patients to do. So one is exercising self-compassion. Just being able to forgive myself for not being able to do very simple things when I'm at the end of a very long day. I also had mentioned earlier focusing on our circle of what we have control over. So turns out I'm a pretty good prepper. In March, I went and stocked up and realized like I could eat off of my food for a very long time. So things like that help me to manage my anxiety. And then I also realized like I can try and depend on the government or the local hospital to have what I need. But first and foremost, I need to boost up my own immune system to try and face any kind of foreign viruses. And then just being able to cultivate things that I always say, if I had enough time, I would. So I broke out my deep fryer, Instapot, and tried all these new recipes. Being able to do hobbies, it also extended into doing improv workshops. So that's a way for me to connect, as well as the many virtual social events such as happy hour, silent reading party, election writing party, reunions with my high school or summer abroad program. I'm an extrovert, so connection is very important to me. And that is also why I take the time to check in with vulnerable neighbors, friends, and family, particularly those that are single or struggling parents. I also do a lot of old school stuff. I'm from a generation where before we had computers, we wrote letters. So I've been sending letters, cards, and care packages to people in need. And then my old colleague slash supervisor reminded me it's important to keep a gratitude journal, because I was telling her, I feel like I'm trying so hard and I can barely manage. And she said just the thing that grounds her every day is to reflect upon 3 things that she's grateful for. And so even small things that don't seem like we should be praising, but like that the portion of the city north of me was evacuated, I get to stay in my home for a few more hours with something that I really needed to be grateful for. So thank you all very much for having this and for building community, Councilmember.
Thank you. I want to again thank you, Ms. Jackie Provost, Dr. Margaret Avineri, Dr. Michi Fu, and Deputy Chief Tingirides. Thank you so much for having this wonderful conversation. We went over, but I think you know, everyone stayed on, and people are going to be able to hear this later on. But I want to thank all of you for being on the panel, and I want to thank everyone who's come onto this webinar for being here today. But I want everyone to know we will be hosting 2 other lunchtime events just like this one on September 17th. And September 21st with amazing guests as well. So you can learn more about these events, webinars, and register to attend on my website at davidru.lacity.org/events. So I want to tell everyone to please continue to stay safe and continue to take care of yourselves. You can always reach out to my office if you have any questions or need any help connecting with resources. Email me at david.ru@lacity.org or call 213-473-7004. And thank you so very much. Thank you to the Commission on the Status of Women for co-hosting. And I hope to see all of you at the next webinar. Thank you all. Thank you.
Thank you.
So much for the opportunity.
Thank you so much. Take care.